All right, so we are live on Facebook, sirs.
Okay.
Yes, so we can go ahead.
Brilliant. So thank you once again, Dr. Gana. Thank you so much for taking out time to join us today. We appreciate that this is a difficult time, obviously. So we appreciate your time. I think just to get us started, I'll just like, again, this is something I think I've done with the other two commissioners that I've spoken to on this matter. I would just like to get a sense of what it is like to be a commissioner for health at a time like this. It's almost like a time of war, right? If you look at it from the demand perspective, what's it like to be a commissioner for health?
Oh, thank you very much. I hope you can hear me very well.
Very clearly.
I'm also very delighted to join you this afternoon to talk about COVID-19 and other health-related issues. I think it's generally an interesting time because it's a professional calling, and challenges are part of any professional endeavor. So it was not something that we anticipated, but of course it came like a bang, and it took us by surprise. So it's quite demanding. It's very challenging, but it's also, I think, a life experience that we'll probably expect to come out better people out of this whole situation, and better equipped to handle emergency situations, especially of this huge proportion of global dimension, affecting people across all, stratas. So I think it's challenging, but also interesting and encouraging, in terms of building one's ability to deliver on the professional call.
That's an exciting way to look at it, Dr. Gana. There's something you said there that hopefully will come out of it stronger. I would like to come back to that in a few minutes, but I also want to check with you. So for the states now, for Gombe State, we're currently at 145 confirmed cases. Is that correct?
Yes, absolutely right. 145 confirmed positive cases.
And there's still about 50 active and 92 discharged and 3 unfortunate deaths, right?
Yeah, well, the number of discharges has just increased by about 10. So we are now at 101, which is the latest figure. We have done some additional discharges this morning. So we have discharged about 101. So the number of active cases would go down by 10.
Okay.
And of course, the number of deaths is still 3. But those active cases, not all of them are actually within the state. Some have moved across to neighboring states. But of course, we got them at the point of entry, so they're still part of what we're accounting for.
Okay. That's interesting. And where do you think the curve is at the moment within the state?
Well, it's still at the top. It's still up. But if you look at the trend from the first 5 index cases that we had, and then the subsequent numbers that we accumulated very rapidly within a very short period of time, if you compare that with what we have now, I think we have stabilized to, a small number in terms of those that are coming out positive. It's not stable. Sometimes it's 1, 2, out of several samples that we're going to say, or we've sent, but sometimes it comes in the region of 5, 8 on daily basis. But I think generally speaking, it's beginning to come down from initial, at the onset when we had 5 and then 21, 15, those high numbers, especially when we, there was this massive movement of people across from, areas of high prevalence, to parts of the country, especially Gombe, where we had 0 cases as at then. So I think the curve should be coming down, and sooner than later it should be flat or so.
And testing is not necessarily one of the major part of our strategy in Nigeria, considering we're not testing that much. What approach are you taking? Is it containment or what? What approach are you taking to try and reduce the impact of this on the public health system within the state?
Well, I wouldn't agree absolutely that testing is not part of our strategy. Testing is part of the global strategy for containing and responding to COVID-19. But of course, on the other side, maybe we have not prioritized to that extent of making sure that, at least a minimum of one center has been established in each of the states of the Federation, and states are able to have the capacity to do the laboratory testing. But if you don't test, then you wouldn't be able to identify, positive cases. And if you don't identify positive cases, then you cannot isolate them and treat them. And by that, it means they're going to remain within the community, and that would be a recipe for community transmission. And then you're going to end up having, exponential escalation of the numbers, and it will be very fatal and disastrous if we allow that to happen. So testing, of course, as slow as it is a key strategy, not only in Gombe or Nigeria, but globally. But of course, the degree of testing varies a lot. So realizing the fact that we have, locally, we have almost zero testing capacity, despite all the efforts that we have made, as a state government, and trying to work with NCDC and the Federal Ministry of Health and the Presidential Task Force. We made efforts, as a state to procure COVID, the compatible PCR machines, along with, all the other materials, that are required for testing of COVID-19. But of course, because generally speaking, Nigeria started very late in terms of preparedness. Maybe the country did not anticipate that COVID-19 would reach us. And so there was very little done until we had the first index case in Lagos. And even after that, the federal government was a bit slow in terms of closing the border, and in terms of getting all the states very prepared, adequately across all the different aspects of, effective containment and management of, okay, start my video. Are you with me?
Yeah, I'm with you 100%, Dr.
Yeah.
Gana. Very clear.
Yeah. So we had a very late start, definitely, but I think we have improved a little bit. NCDC has scaled up the number of testing facilities across the nation, even though in our own part of the country is still almost zero, because I don't think we have a laboratory that has the capacity to test for COVID-19 in the whole of northeastern part of Nigeria. So the nearest that we go for our sample testing is VOM, the Veterinary Research Institute. Yeah. And before VOM was accredited, we had to go all the way to Abuja under, the lockdown situation, going through Bauchi, Plateau, Nasarawa, and then FCT. And it was literally a daily affair. It was quite hectic and very expensive in terms of the logistics of moving the samples. So I think it was a huge gap that was left, wide open by the federal as well as the states. But of course, when we placed order for our own PCR machine, it took a very long time. I think the machine just arrived in Nigeria in Abuja a couple of days back, and we're still trying to get it across to Bombay, so that we can quickly set that up and get NCDC to accredit, our laboratory. We have the space and we have the technical capacity and manpower to do COVID-19 testing in Bombay State. So as soon as the machine comes in, probably after the public holidays of Monday, Tuesday, we should be ready to receive NCDC, in Bombay State. And so we will set up our laboratory, and that would easily give us an additional opportunity to ramp up, the number of tests that we do in the state. And so in addition to the one being done by NCDC across, we have our own, then more people are going to get tested. And if we're able to test more people, it means we'll be able to identify those positive COVID-19 cases, isolate them, treat them, and then we'll make sure that we don't have, a community transmission happening there. So the strategy is still centered around testing, but it's also, hinged on creating that level of awareness and engagement with the community, so that they understand what COVID-19 as a disease is all about. What are the symptoms and how do they, prevent the disease from, finding a place in their communities through, personal hygiene, social distancing, and all the things that, are required. We have spent a lot of time, a lot of energy, and a lot of resources right from the beginning of the outbreak to enlighten the entire citizens of Gombe State in terms of what COVID-19 is clinically and how the community would have to play their individual roles, roles as a community, as families, as individuals, civil society organizations, non-governmental organizations, traditional, religious, and all the different segments of our population, were engaged. And we're still engaging with all of them, on a continuous basis because, COVID-19 is multifaceted, it's multidimensional. It's not just a health issue anymore. It's, a social and economic, psychological as well as, physical. It has, very serious implications and effects on the entire lives of this world. And of course, Nigeria and Gombe State are no exception. So that is also an important strategy. We have also, in particular in Gombe State, realizing that, COVID-19 started from China and went around the whole world and then got into Nigeria through ports of entry, Lagos in particular, and Abuja. And then Kano, which is the nearest, state that has a very high, prevalence of COVID-19. And then the very close nature of, interaction between our people in Gombe State and Kano State. Many of our citizens are businessmen, they are traders, so they transact business between Gombe and Kano. And so there was this flow of people, especially from Kano down to Gombe. And so we decided as a strategy that we're not going to wait for people, within the community to develop symptoms of COVID-19. Yeah. So we mounted roadblocks across, especially the borders of Gombe State. And the governor passed an executive order with a proclamation that interstate travels were banned. So working very closely with the security agents and then the health workers that were stationed at the borders, we were able to check, the rampant entry of people into Gombe State, and especially those coming from high-risk areas. And even, kind of moving away from the established protocol then by NCDC, we decided to be testing all high-risk individuals, all those that are coming from those states that are heavily infected with COVID-19. So as long as you're coming from Kano, or you're coming from Lagos, or you're coming from Abuja, FCT, despite the ban on interstate travel, we don't just tell you go back, but we take you in. And we have established a quarantine center, which is on the outskirts of the state capital. And that's where there's a clinic there where we kind of profile you, and then we take your sample and we keep you under a close quarantine custody, and then we send the sample. So, and when the result comes back, we take the appropriate decision of either sending you to the isolation facility, or once we are fully sure that you're free of the disease, then we allow you to proceed to wherever you're going to. Some of those that we got were intended to go to Borno, some to Yobe, some to Adamawa and Taraba, because Gombe as a state is centrally located, within the northeast sub-region, and we share boundaries with all the other 5 northeastern states. So people are traversing through the state. And in short, that's how we got those high numbers, especially at the beginning. It's not like those numbers were picked from the community, but they were picked actually on the road, trying to make entry into Gombe State. Oh, wow. So if we had not used that strategy, these people would have easily come into the state, settle in the community, and transmit COVID-19 across the various parts of the state. And today it would have been a different story. It wouldn't be, Gombe is still largely verified. There's no evidence of community transmission anywhere across the entire Gombe State. And so I think that has worked very well, and we have shared that as a big lesson with
I think we're having a bit of a problem with the connectivity there. I'm not sure if it's mine or from the commissioner. EIE, can you hear me?
Some of the federal, or say active case. Are you there?
Yeah, I'm here. I lost you for a bit there.
Yeah.
I lost you for a bit there.
Okay. Okay. So I think that strategy worked very well by making sure that we picked all the positive cases. And we isolated them, and they feel that arrive into the people, the citizens will call and say, I have a neighbor who has just returned from Kano, or he has returned from Lagos, and we are not comfortable. He's a high risk individual. And so we mobilize our rapid response team to go there. And unexpectedly, the guy or the lady will just see us there. So we're here to, because we were informed that you just arrived from this and that, and going by the protocol, we have to do A, B, C, D. So we'll profile them again. We'll take samples from within their residence. And the protocol initially was a kind of self-isolation at home, pending the outcome of the result before NCDC decided to change that due to non-compliance. So we were able to do that at the beginning. But of course, we noticed right from the beginning that there will be problems with people going on self-isolation, because many people still don't believe that COVID-19 is really, a disease. In reality, they think it's a kind of, a disease that people, exactly, that some of us in the health sector have invented that so that we can make some money. Or the government, there are allegations of people saying that the government imported 5 cases from Kano and they paid 50 billion for those cases to be brought to government. You can imagine. So, but anyway, you can't run away from that, because you're dealing with human beings, and the human mind. People have different backgrounds. They have different understandings. Absolutely. Some are enlightened, some are not. Some have even refused to become enlightened about COVID, no matter how hard you try. So, but we have maintained our policy and principle of, being very truthful about the issue, being very open about the issue, because we did not invent COVID-19. COVID-19 did not start from Lagos or Nigeria or from Abuja or Gombe. It started from China, and it moved across the entire globe, and we have seen how it has ravaged, big economies across the world, big nations that have, very, very strong health system, very strong economy, very enlightened people who can take personal responsibility for whatever situation they have found themselves. So if you compare those societies where the disease has has ravaged extensively with our society, in fact, you can but thank, the Almighty Creator for making it even a very mild, COVID outbreak in Africa, especially and in Nigeria. Because if it has come with the kind of virulence that we have seen it happening elsewhere, then would have been in big trouble in Nigeria, especially with, the different beliefs and, principles.
You've answered quite a number of my follow-on questions, but a few that I want to pick out. The one on the community engagement, because we've seen across Nigeria a lot of people with strong influence and followers claiming that COVID-19 is not something for Africa. Are you pleased with your community engagement activities in Gombe State, or do you still see some gaps in being able to enlighten people to do the right thing?
Well, I think we have done extensively very well in terms of community engagement, both as a task force and as a government. The very first thing that we did, ahead of the outbreak or the first index case in Gombe, apart from making sure that our isolation facilities were well prepared ahead of time, because we were able to achieve that within a very short period of time, both in terms of centers for treating mild and moderate cases, as well as intensive care unit where, all the necessary height equipment, were brought in and stationed. well ahead of the outbreak. And not waiting for that, we quickly went into, community enlightenment, community mobilization, health educating people about, what COVID-19 is about, and that we should anticipate that it's coming in, and what people need to do as individuals, as families, as communities, and as a state for us to be able to contain, the rampaging virus. And we have in our midst as a task force, people with traditional, leadership background. There's the deputy chairman of the State Council of Emirs, is a member of the task force, and that kind of gave us the key, a kind of access to the entire traditional leadership of the entire state. And we also have membership from the two major religions, the representative of the Jama'at Nasr Islam, the Muslim group, is a member, and then the chairman of the Christian Association of Nigeria is also a member. In addition to, the multi-stakeholder team that we have, as a task force. So it was quite comprehensive, and we went across the nooks and crannies of the state, physically engaging with the different, categories, groups of people. We embarked on very massive media, especially, our people listen to radios a lot, much more than, reading newspapers and looking, watching televisions. So we had massive, programs across the different media, electronic, print, and so on and so forth. And of course, the leadership, the Muslim groups, as well as the Christian groups, and the traditional leadership also took upon themselves to, kind of escalate the discussion and the enlightenment to their followers. So churches and mosques and traditional palaces, at the different stages were all involved in enlightening people about, the ABCD of COVID-19 and what people should do. So that really created a lot of, awareness. And then the governor, played a very strategic role, which I have not seen across any of the states in Nigeria. He was personally involved in, especially engagement with, community leaders. Yeah, I can count at least 5 to 6 series of meetings that he has held with emirs, with leaders of the Muslim group, with leaders of the Christian groups, with so many other high-level, stakeholders, in a bid to ensure that, connectivity between what the government is doing on COVID-19 and what those groups also stand for and what they should do. And of course, there are a lot of, because of the sentiments attached to COVID-19, people, had different complaints that, you close our places of worship. How do we just stay at home when there's an outbreak? We need to go to our mosques and churches to pray so that this outbreak will go. And then, of course, for you to balance that as a leader, when you have an outbreak of a highly contagious disease, which if you allow people to congregate, the disease can easily spread because it doesn't care about your religion. You'll be praying, but it's also hunting and looking for you. So, that called for a very visionary leadership for you to be able to manage such crisis. We've gone through, thick and thin of, managing, the consequences of, COVID-19 around the communities. And in particular, Gombe didn't go into 100% lockdown. The governor insisted that he was not going to go on 100% lockdown because if you lock people down for 100%, then how many of them have to go out on a daily basis to seek for livelihood? And of course, the economy of the state is not strong enough to ensure that everyone is fed. I don't think even Lagos, as strong as it is, will be able to do that. Even though they were fortunate, at least they had some federal support, at the beginning. But we never had any support from the federal government in terms of funding for, all the interventions. So it's the state that has been doing it all along, funding, and then of course we still support from other interested organizations across. So I would say we have, done very well in terms of that, but it can be 100%. We are human beings, and despite all the level of engagement, there are still pockets of people who still maintain their belief that COVID-19 is not true. And so we are not going to relent on that. We'll continue to hammer them. We'll continue to push the information, and we'll continue to provide them with the facts and figures, hoping that one day they will agree that this is true before it hit any of them. We are not praying for that. So there are still areas of improvement, and we're working on that. So it's an ongoing process.
Absolutely. I wanted to ask you on the testing. You said that the state is now making effort to improve local testing capacity. We've seen cases in Lagos and places like Ogun State, and I think a few other states. I know there's also a move in Kano to partner with private organizations. I think one of the popular ones is the Life Bank or 54 Genes, where states are opening up their own testing facility, working with these private organizations. Is that something that you think would work in Gombe State? If so, have you seen any of them reaching out to talk about the possibility of setting up something?
Well, absolutely. As I mentioned earlier, the response, to COVID-19, is not only the responsibility of governments. It is the responsibility of every one of us. As I said, it's not only a health issue, it's also an economic issue. So if you're a businessman or a manufacturing company or whatever you're doing, if COVID-19 gets out of proportion, your business will simply also completely flatten. And so that it has to be a collective effort, a collective responsibility. So in Gombe, of course, we took that upon ourselves as a task force, and we wrote literally to all major private organizations, that have some connection with Gombe, even those that are not based in Gombe. We wrote to some of them, that especially that we have their contacts. But Gombe is not like Lagos, and it's not like Kano. We're a small state, and we are a small economy. And we don't have a real manufacturing base. We don't have those kind of companies that you see in Lagos or in Ogun or in Kano, where you would have strong private sector presence. But I think we're still very grateful to the few of them that have shown interest in supporting the state, particularly the coalition against COVID, led by Alhaji Ali Dangote. We're immensely grateful to them. They just help us set up 2 additional isolation facilities, of 110 beds, with all the accompanying equipments that are required to manage, especially mild to moderate cases. And I think that is quite significant. And I would say it's probably the biggest that we have received so far from the private sector. But of course, there are pockets of support, in terms of face masks, in terms of personal protective equipment, in terms of sanitizers, soaps, and what have you. So many organizations, have come forward to make some contributions, and that has helped a little bit. Construction companies, of course, have donated some funds, which has been used, in containing the COVID-19. I think what we have not seen clearly so far is a group that has interest in supporting the laboratory capacity. We haven't seen that so far in Gombe. Not a single one has come forward to offer that. And so, but of course, as I said, the state government did not wait for that.
Absolutely.
Because we ordered for and the government paid for. So as it is now, that equipment has arrived Gombe, and that is COVID-19 specific. So as soon as that is mounted, I think for the size of Gombe and for the size of the cases that we're seeing, we should be able to run about 140, specimens in a day. And if we can run 3 shifts fully in a day, then we should be able to have at least 140 specimens tested. And by the, incidents that we're having, I think that is a very manageable size. But of course, those are quite open. We're encouraging, organizations and individuals who still want to come and support the state in that perspective. One lab is just the beginning of it. If we can have 1 or 2 additional to make 2 or 3, that would kind of, escalate the numbers, scale up to a very significant extent, because we have the technical capacity and the manpower. Apart from the state system, we have a state university, that has qualified individuals that can do that. We have the Federal Teaching Hospital, who are also part of the entire containment strategy that we are working on. And so with little support, especially from the NCDC and other good spirited individuals, I think we can scale up that and ensure that we do testing.
That's exciting. That's exciting to hear. It seems like there's a lot the rest of the country can learn from Gombe as well. You talked so proudly about the containment strategy that you implemented, and you mentioned that you were already sharing this. What sort of research opportunities do you think is there in the state at the moment in terms of better understanding how to manage things like this, documenting it, so that in future, if there's anything similar at all, we can leverage that opportunity to improve the public health system in the country? Are you seeing any interest in funding research? Is there anything that is being done locally around research? Also, in terms of technology as well, are you seeing any specific smart use of technology or interest in funding technology around COVID in the States?
Well, that's not there isn't much of that, of course, expectedly. Of course, there are a number of research interests, local research interests, because as I mentioned, we have the state university, especially with the medical college, as well as the Federal Teaching Hospital, and then the specialist hospital, where we have very senior medical personnel who are engaged, in the containment strategy. And looking at the way the disease is evolving, there are quite a number of research issues that people, are interested in, both at the community level as well as, in the process of managing, the various cases that we're putting in the isolation ward. For instance, one can look at the attitude of people, based on their educational, background. How do people understand, COVID-19, and how do they respond to COVID-19 at the community level? And what strata of the community best understand and best approach, the COVID-19, as an issue that they need to partake in. So I've seen a couple of guys that are expressing, interest in finding out, those differentials within the community setup. And this will obviously provide some answers as to why certain people believe in COVID-19 and have taken the right action towards, its prevention and management, and then why some set of people are still very skeptical about what the reality of COVID-19. So what sort of background are they? Why? What are the influencing factors that has really made them to insist that this is not a disease that really exists in reality? How much you're taking into consideration when you're designing your, especially IEC materials and your strategy for mobilization and engagement. So this is, I think, very important. As well as, of course, also those cases that we're keeping in isolation, they differ in terms of, the way the disease manifests in them. Fortunately, most of our patients in Nigeria are mild and many asymptomatic cases. So why is it that most of our people are asymptomatic? Why is it that the disease is manifesting differently in Nigeria from the way it did in especially Western Europe and Northern America? Are there environmental factors, that are, have really kind of rendered the virus less effective? Or are there things that we do that is actually giving us a different outcome in terms of how we manage? So there are a lot of operational research questions that people can raise and answer, so that we better and more effectively manage, those cases in isolation, without having to go through some of the bad experiences that many of us are seeing at different stages. And there are quite a lot of social and psychological issues around COVID-19 patients and the process of managing them. And those are potential areas for research. Social researchers should come into that, and then they will help us to better understand what are the social and psychological issues, as well as economic and other factors that affect, the outcome of COVID-19, in those confirmed cases. So those questions are very much around, but the big issue is funding.
Funding. So which is the question I was going to ask you?
Yeah, funding. As a government, generally in Nigeria, we are not research oriented. I'm sorry to say that. We are not research oriented. We always, manage things and have, we keep aside this big issue of research, which provides us with a foundation for us to, build our system, strengthen our system, and ensure that we manage situations, not just relying on the Western world, to invade and innovate around issues like this. And, it's COVID-19, yes, is a pandemic, so it has global implications. And those people in the Western part of the world who invest heavily in research, they're going to come out with something ultimately because it affects them. But then if you look at other diseases like Lassa fever, like Ebola, that are predominantly African diseases, if we don't invest in research, we're going to have these diseases killing our people for as long as possible, because the Western world is not going to invest on our system just to make it stronger. We must do that ourselves. So I think that is a huge gap. But of course, it's not just the government, but also private organizations need to come in, because it's part of a corporate social responsibility that companies, organizations that have the strength to do that should kind of institutionalize research as part of what they fund, so that they can give out research grants. And I think people like Dangote or Tedola and all the big corporations that are here in Nigeria should have some dedicated funds for funding research around some of these current issues, not just giving the support in terms of setting up facilities and so on and so forth. Dangote is doing fantastically well, and I think we commend him, for the leadership that he's been given, in terms of supporting particularly the health system, working very closely with Bill Gates. I personally come across these two people, working with them and seeing the passion that they have, for supporting the population. But I think they can do more. Dangote can do more. I'm sure they will do more, by providing research grants, especially around the COVID-19, but also Lassa fever and Ebola and other, epidemic-prone diseases that we have in Nigeria. That we shouldn't actually be having many of them if we're doing the right thing.
Absolutely. I was gonna ask you whether it was a smart thing to mobilize private funding for research, but you've made a strong case for that already.
Absolutely.
You've made a strong case for that. I think, this is the point where we start to take questions. We have just under 20 minutes left. If there are questions from Facebook, please do share. But in the time being, I'll go ahead as you share those questions with us for Dr. Gana to answer. I'll go ahead with a few other questions. Dr. Gana, capacity is a major problem with public health in most African countries, not even just Nigeria, but also obviously in Nigeria. And we've also seen we've heard about, I think it was NMA secretary in April this year that says that there's mass exodus of doctors leaving Gombe State. How do we, and this is not unique to Gombe State, it's a problem across the entire, country. How do you manage this as a commissioner? Capacity is a big issue. How do you manage this? And what are you seeing for the future of our ability to actually retain medical doctors? You're a practitioner as well, yeah? So how do we retain them? What can we do to improve the situation?
Well, I think it's simple and very straightforward. Brain drain did not start in this decade. Absolutely. Or the last decade. Mm-hmm. I finished school almost 30 years back now. And if I may recall very well, in my set that graduated that particular period, almost 50% of us did not even remain in Nigeria to do the basic youth service scheme. Most of them trained into, to UK, to the US. And if you go there now, they are big time professors and, research fellows, that are contributing to big research across the globe. So this is not something that started now. And when we came in, we found quite a lot of issues around, retention of doctors in state. And it was a policy of the government, not even this one, prior government, to kind of sponsor, they roll out a training scheme, as a sustainable way of providing, all those required professionals, doctors, nurses, midwives, pharmacists, and laboratory technicians, and so on and so forth, who were supposed to be servicing the health institutions in the state. And so once you get admission into a government-owned school, you're placed on a certain salary structure level. So that kind of bond you to the state. And so when you graduate, they still pay you until you finish your NYSC. And as soon as you finish, you come into the system automatically. You serve a bond of 2 or 3 years, and then you can go for postgraduate if you want. And then ultimately you are free to. So the situation is such that at least at the entry point, those basic numbers are available, because every year we graduate a certain number. For instance, this year alone we graduated about 20 medical doctors from the state on university. And these are doctors that are bonded to Bombay State. And so they come into this, they now make up their mind to either continue to move on. So that's sustainable as it is needed. But people have different objectives. As I said, some even plan to leave the country. There's no way you can stop them, especially as a doctor who was qualified and he wants to go for greener posture. And particularly in Gombe, most of the exodus is not actually outside Gombe. The hospital is there in Gombe. And of course, there are differentials in terms of pay and other, allowances, because this is a federal agency and it's not exactly the same with state governments, not just in Gombe, but across the nation. So many of them have opportunities for postgraduate studies, at the FTH level, and so they get better pay. And so it's of no use for you to insist they must stay in the government state service instead of allowing them to go for postgraduate, and then they become consultants, and they will still come back and service the people of Gombe State. So for us, I think we don't see that as a loss into the system. We have trained them with basic education. They have served, they are born in Gombe State, and they are now moving to a tertiary center, still serving people of Gombe State. So they are still retained within the network of, health professionals that are working in the state. But of course, we are not relenting in our effort to ensure that we have higher retention, rate of those people that are coming into the system. The State Specialist Hospital is just about to commence the internship program for doctors, and pharmacists, where they would do their housemanship. And that is huge. Instead of sending them to the FTH, the Federal Teaching Hospital, we will retain them within Gombe State. And that will add to the number, and so opportunities are there, and we'll continue to encourage them. We'll continue to improve on the welfare of, health workers, so that they also feel comfortable to work for the state. So it's an ongoing concern, as you say, across the entire federation, with no exception to Gombe. Yes.
So, but so one of the things that is a major problem at a time like this, you mentioned Lassa fever, for instance. This is something that we've been battling with as a country. Acute malnutrition is also an issue that we've been battling with. How are you seeing states, including Gombe State, juggling the need to look after COVID-19, but also all these other healthcare requirements of our citizens, especially when people are too afraid to go to hospitals? What are some of the things you're seeing as a way of balancing the demand for healthcare at a time like this in the States?
I must confess that it's a huge challenge. It's a very difficult period. A couple of months back, we sat down, as a new government, we did a very beautiful plan. Our budget, we were able to have, the 2020 budget for health close to about 10% of the total state budget. And the governor came in with so much interest on health. In fact, if there is, I think I would say his top priority is health. He has so far invested within the last just less than a year. He has invested close to 2 billion into Gombe State health system. And that tells you that he is, very much interested in offering effective and quality health services to the people. And we have, a very ambitious plan for especially the first 2 years around health. But then suddenly COVID just came in. We were in the midst of managing the Lassa fever outbreak, and then COVID just dropped down from nowhere. So at the point in time, we had patients, on Lassa, struggling for the isolation facilities, and then we got this one that is different. It requires a different isolation facility. So the isolation facilities that we had in the past they're not useful for managing COVID. You have to now go and do negative pressure isolation rooms. You need intensive care unit because of the airway related complications of COVID-19. So entirely a different ballgame, dealing with isolation of people with gastrointestinal diseases like cholera, outbreak, and then to hemorrhagic fevers like Ebola and Lassa. And now you're dealing with airborne and airway related epidemic of COVID-19 proportion. So it became an entirely different ballgame, a completely different ballgame. So you have to set some of these facilities from zero level. So monies that were meant for investment into the health system on different aspects, strengthening the health system, have to be diverted now and poured into the resources that are required to contain the COVID-19 pandemic. And you have no option than to do that. And in an economy like that of Gombe, that is not so much, it doesn't have high resilience, because most of the funds the government gets comes from the federal allocation. We're still battling with low internally generated revenue for all the reasons that I have talked about, lack of manufacturing base, and the private sector is not very strong and vibrant. So, and individuals are not that rich enough to be paying tax. And anyway, the mentality of Nigerians generally around tax payment, even for those of us that are middle cadre and go, apart from PEs, many people don't like paying taxes. So that makes it very difficult for the government. And so the big issue is prioritization. We have to reprioritize. The whole budget has to be revisited, just like the federal government did. The benchmark, for our was moved down for the budget of 2020. And so all states will have to do that. Maybe Lagos might be an exception. They will have a better, they have better resilience to issues around that because they have a big economy. But for small states like Gombe with a very small economy and poor manufacturing base and other sources of internally generated revenue, we have to reprioritize. A lot of the funds have gone into COVID-19, and government has been shut down, kind of, because there's really nothing happening around governance now apart from containment of COVID-19. So this is something that is unprecedented, that we have not seen for the whole of our generation, and even the generation before us have not seen, a disease entity, just a single mention, and unprecedented effects on our economy. To farm might be a problem now. So even many of our people might not be able to go and do farming with all the lockdowns that are happening. If you lock people down, how do they even move across to go to farms? If they don't go the farm, most of our farming is, kind of a seasonal thing. People should be going to farm now to get themselves ready for, what to eat in the next couple of months. And so if they are locked down, where the lockdown is absolute as it is in some of the states, I'm sure you have discussed with my colleague, Dr. Amina from Kaduna. Lockdown is a very serious thing in Kaduna, and it has a long-term effect. If you put your people down closed completely and they are not able to go on with their normal businesses, the consequent effects, on the long term would be very serious. But of course, the government has to also balance, the allowing the infection to spiral out of proportion, as well as also, managing the economy. So I think governments must find, a balance between, these forces. It can be absolute in any direction. I think this is the reality of the issue. It can be absolute, and especially since looking at the severity of the disease in most of Africans, I'm not trying to underestimate or understate the effects or the impact the disease can have, because community transmission is, I think, the most dangerous aspect that we're trying to avoid. But so far, I think for the numbers that we have seen, the great majority of Nigerians are having a very mild form of COVID-19, except, of course, in situations where we have community transmission setting up, and then those aged people or children whose immune status is not strong enough, or those that have existing, comorbidities like hypertension, asthma, diabetes mellitus, HIV/AIDS, cancers, and other autoimmune diseases that are, likely to drop down their level of immunity, and they're not able to handle COVID-19, as mild as the strain is. And most of the mortalities we are seeing are actually from, those that have those comorbidities. But an ordinary, strong, able person is able to manage, the effects of COVID-19 in most instances, even asymptomatically, and they get cured fully and they exit out of the system. So we must balance these forces, not just locking down people 100%, at the expense of our economy, individual economies, financial capacity of families, ability to feed, because no government can feed all people. And people will have to go out to some extent. So governments must strike a balance. And that's why I said, particularly for Gombe, we saw the vision, as a task force, we recommended lockdown, especially at the peak of when we started picking the positive cases in Gombe. We were very much afraid. Lagos, as big as Lagos is, it started with just one index case. Gombe started with 5 index cases. On the same day that we took those samples, and then 5 came back negative.
That's quite
positive. Sorry, 5 came back positive. So it was a kind of very disturbing. And we thought, if this is happening, and knowing fully that people have found ways to go into the communities by bypassing the border points, the checkpoints, we were afraid that they were rushing down to come from Lagos and Kano, coming into the communities, and they will end up kickstarting community transmission. So we wanted a complete lockdown, at least for a period of 1 to 2 weeks, so that we can go into the communities, do contact tracing, isolate people, pick them out of the communities, and then treat them. So, but fortunately, the governor, of course, saw a different reason. He tried to balance the effects of the whole thing. And we're very fortunate that at the end of it, we succeeded in both ways. We succeeded in making sure there is no community transmission, as well as also allowing the community some degree of movement, so that they move in between and they transact some little businesses with advice on social.
Hello, I think
distancing, of the personal cleanliness and so on and so forth. And ultimate of it is. Are you there?
Yeah, I'm back. I lost you for a bit.
Yeah, because the source of my internet is on the phone, and some people are trying to call me. So each time a call tries to come in,
we only have
interrupts that. Yeah.
We only have 4 more minutes. We know you're very busy at this time.
Okay. So let me allow you to talk.
Yeah, I've got a couple of other questions. I just want to ask you one question that is from Yemi, which I think is an exciting question, is if you had an unlimited budget, what 2 or 3 things would you prioritize for the ministry at this time? Whether it's COVID
or
whether it's
COVID related,
whether it's COVID or not. If you have an unlimited,
one is human resource capacity, in terms of the number and in terms of the quality, their capacity. We have to be very resilient in that, because you can't predict, to what extent this COVID-19 is going to take us to. And 2 is to ensure that we have sufficient testing capacity across the nooks and crannies of Gombe State, and indeed all the other states, because you must test. Testing is really the key to making sure that you check, the excesses of this virus. Those are my 2 top picks.
And maybe this is also related. My next and final question, maybe it's related, but maybe not. What are some of the biggest pain points that you're currently facing as regard COVID-19 at the moment? What are some of your biggest pain points? In terms of COVID
challenges?
Yes.
In terms of what the key challenges?
Yeah.
Well, I think limitation in terms of funds availability is huge, because the government is the one that is, funding most of these activities. And if you look at just people that are working on COVID-19 are not just working free of charge.
Okay.
People must understand that, despite the fact that many of them are paid salaries, because of the specific, the hazardous nature of the COVID-19 response, there has to be provision for, hazard allowances, and it's quite huge and exponential. It costs a lot of money. So funding is key, and I think the earlier we look at that, the better it would be. And nationally, I think we need to right-size our operations instead of the task force kind of emergency approach, which I think people are beginning to see. COVID-19 is not going to disappear immediately. And the more we mainstream our strategy to contain COVID-19, the earlier it will be for our health system to resume back to normal. As it is now, we're only doing sketchy services in our facilities. So as soon as we now internalize COVID-19, we have many other control programs, in our ministries of health, for different infections, for chronic diseases, control, malaria control, tuberculosis control, HIV control, the polio eradication initiative. So I think we need a mainstream initiative on COVID-19 for the next couple of years to ensure that the states and the country continue to manage and contain this virus, in a very systematic way, not that ad hoc kind of, emergency task force that stops everything and, life comes to a stop because we have a virus that is moving around. But at the same time, not losing sight of, those key interventions that we need to continue with. So if there's one big suggestion that I want to pass, especially to the presidential task force, to the government of Nigeria and states, is to mainstream, the containment of COVID-19 into the right sectors so that people can respond, from their official capacities. People can go back to work, hospitals can go back to function normally, and then we have a group of people that are focused on containing COVID-19 in partnership with the private sector, civil society organizations, the communities, and all the other stakeholders in the system.
Thank you so much, Dr. Gana. It's been an insightful conversation, and I like the your last point. It is not something that a lot of people are talking about, but we have other issues that we need to deal with. So the sooner we come up with a clear strategy that allows existing issues to go on parallel with COVID-19, I think the better for us.
Yeah, if there is one point I would like you to propagate is that we must just go back to normal functions while we don't lose sight of COVID-19. Let's mainstream. HIV/AIDS came in with all the cries and so on. It has been mainstream, and stakeholders and different sectors are involved, and we're still going on with it. Our lives are still going on. Okay. Just like with the other diseases. COVID-19, I think, also requires that approach. It will save cost, it will save us time and energy, and will be more effective and efficient than this, kind of emergency, ad hoc, haphazard, rapid, which will not really work on long term.
It's not sustainable. Thank you so much. We appreciate your time, and we wish you well with the effort to contain this in the States. You'll be in our prayers, and if there's anything we see that we think can be useful to the state, we'll also let you know, sir. Thank you so much for taking out the time. Thank you.
Thank you very much. I also appreciate this opportunity, and I look forward to future interaction. God bless you.
Thank you, sir. Enjoy the rest of your day.
Okay, cheers and bye-bye.